Hello everyone, welcome back to my channel. This is Aryan Sakshi. So in today's video we are gonna discuss about IV therapy complications. So guys, you are nurses, you already know like intravenous means when we administer medication directly into the circulation, like into your veins, right? So what happens like sometimes when we are administering medication through the veins, so there are some like four kinds of common complications which can happen, like if your cannula creates a problem, or maybe cannula doesn't fit in properly, right? So the most common one which you can see here is infiltration. Okay, so what is infiltration? That's IV fluid leaks into the surrounding tissue, right? You can see in the picture, like if the medication leaks into the surrounding tissue, that can cause your infiltration, right? So what will happen? Pain, of course. Now think about it, like of course if the medication is leaked into your skin, into your surrounding tissue, what will happen? You will have pain, there will be inflammation, and there will be swelling, right? And you can see there will be coolness, it will be very cool to touch, okay, because medication is already leaked into the skin. And then numbness, right? Patient himself can feel the numbness, right? So it will be very numb to touch. And then just think about it, infiltration means instant swelling, so there will be swelling, right? There will be enormous, like huge amount of swelling, right? Moving on to the next one, phlebitis. ITIS. Phlebitis means inflammation and swelling, right? So, or maybe itis means inflammation and infection as well, right? So inflammation of the vein, right? So phlebitis is inflammation of your vein. So what will happen if something is swelled up? You will feel warmth, you will feel redness, right? You will feel pain, it will be very tender to touch as well if something is inflamed, right? So phlebitis, think painful veins. From phlebitis, P of phlebitis means painful, P of painful veins. Very simple. Next we have hematoma. Hematoma means clot, collection of blood in the tissues, that means clot formation, right? So when there will be collection of blood, right? Of course then you can see the bruising, the purplish color thing, right, on your skin. So that means there is formation of bruise, that means somewhere your blood is getting collected. Then hard and painful lump as well, right? So that's your hematoma. Okay, so of course there will be painful lump. So from hematoma, think heavy blood. Hematoma, H for hematoma and H for your heavy blood. Next and the last one is your infection. Of course, sometimes there can be infection, as sometimes there if we don't clean it, right, if we don't take care of it, right? So the microorganisms can just lodge in across the surfaces of your cannula, so, or your skin as well. So that's why we have to maintain a clean technique while doing the IV therapy. So microorganisms enter through the IV, so you can have, of course, think about it, if someone has infection, what will happen? Fever, chills, of course, redness, swelling, pain, tenderness. And in fever, tachycardia is common, right? Because your heart is having hard time to deliver oxygen to your organs and your tissues. So tachycardia, right? Increased heart rate. So that will be more common, like just common things, right? So infection, think increased temperature, right? So I for infection, increased temperature, right? So these are some common complications of IV therapy. Just practice it. And what will be the nursing steps for these ones? Like, of course, if it's infiltration, right, or phlebitis, what we have to do first, we have to stop the infusion. First and foremost is stop the infusion and remove the device, right? Second one is we have to elevate the limb, right? Like we have to elevate the limb so that proper circulation of blood flow can be, reach to the surrounding tissues for the patient comfort, and it will also elevate the pain level of the patient as well. Apply the warm or cool compression, right? It depends upon the infiltrated solution, because like many facilities have the policies for that one as well. So it depends on the solution, like do we have to give the warm or do we have to give the cool compression, right? For not for every kind of infiltration or phlebitis we can just apply according to us, like okay, we will give the warm compression. No, it depends upon the facility in which you're working. So it's very important to get familiar with those protocols. The other one is we have to check the patient's vitals, of course, pulse and capillary refill time. So what is capillary refill time? Like if you press the thumb, how much time it takes to get to the normal color of your skin, right? So we have to check these things, right? And then of course we have to perform venipuncture in different location, and we have to restart the infusion as ordered, and always check the site frequently, right? And document like what you did, what interventions you did, right? So these are some common things. So these were the common ideologies. Okay, so always remember, like if the question comes like the patient is having infiltration, so what is the first and priority action the nurse should take? So you will mark stop the infusion and remove the device first, right? And then you will do whatever you have to do, right? Like checking the capillary refill. So capillary refill, I already told you, like it's the, so when you press your thumb, so how much seconds or how much time it take to get again get into the normal color. So it should be less than 2 seconds ideally, right? So between 2 to 3 seconds is fine, but less than 2 seconds is the optimal timing. Okay, and like always observe the IV site frequently. Like these are some indications like we have to make sure. So yeah, these are some tips and tricks for your NCLEX RN examination. Like sometimes they confuse you, sometimes they will say like the nurse will establish the catheter patency, or maybe they will give you the other option. Maybe she will check the vitals, or she will check the pulse rate of the client. So these are the things which need to be done. But first, if you are seeing the signs that the drip rate is going very slow, the infusion is administering very slow into the veins, so you have to remove the device, right, and stop the infusion. So good luck for your preparation. Thank you.